What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Your father is so super. Superman had to change his name to just Okay Dude. Why did the farmer trade cow manure for goat poop? It was a dung deal. Did you hear about the robot that went skinny dipping? It was quite shocking.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Why am I saying now a podcast after, 15 years of doing it as a podcast? I don't know. A little too lazy to change the script. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner. Oh boy, this is going to be a good one. Who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacie, who is my partner in this and all things. Hello, Tacie.
Hello.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Really just too lazy to go back and do it over again and do it right. Sorry, everybody. Check out stuff.drsteve.com, stuff.drsteve.com for all your shopping needs. Still working on drsteve.com. All the stuff is still there. It's just in different places, so click around. If you see the 3 dots, click on that. All those menus will come back, and I'll have it up just as soon as I have 5 minutes to work on it. And check out Dr. Scott's website at simplyherbals.net. And then Tacie and I are doing Patreon at patreon.com/weirdmedicine. The Gino Visconti show will be edited today and up today. So if you're hearing this, well, That's my plan anyway. I have to. It was an hour long. It was supposed to be 15 minutes of him just yelling at us, and now I have to listen to the whole thing to cut out certain words that I even on Patreon I'm not putting on there because Patreon is leaky too. People can post it. Well, look at what Dr. Steve's allowing his guests to say. So anyway. All the stuff about the vaccine, that's fine. Whatever he wants to say, that's his thing. But they're just, like I said, some naughty words that I can't. And I told Anthony about it when I was on last week, and he said, "What a surprising thing to have happen." Gino said something inappropriate. And if you want a cameo done in the studio, go to weirdmedicine.com go to cameo.com/weirdmedicine. I'll say fluid to your mama. We're going to do one today here in the studio. Say you want to do it in the studio. If you want me to do it from Rochester, February 3rd, get tickets at watplive.com. But if you can't come, send me a cameo request and I'll, get some celebrity to do it with me. A Z-list celebrity, but a celebrity nonetheless.
Have I made it to Z-list celebrity yet, do you think?
No.
Oh, yeah. Double A.
Me neither.
Maybe a double A. Maybe I'm a double A.
Well, like a Z and double A. Yeah, on that we might be triple A.
Oh, okay, yeah, that's close enough.
Yeah.
That's good for me.
If Pete, okay, so here's the difference or the distance. Our friend who was on our Patreon with us, Pete Davidson, he's probably our most famous friend. Mm-hmm. The difference between him and us is like Michael Jordan to basically me playing basketball.
Either one of us, or both of us together.
It's kind of the scale is about the same too. Yeah, so there you
agreed.
Go. Anyway, all right, and don't forget to check out Dr. Scott's website at simplyherbals.net. That's Simply Herbals. Oh, what did you bring? What did you bring?
You
what is
something
that?
good.
What is this?
That's the CBD nasal spray.
Oh, now we're not. This is not an advertisement.
No. It's just a gift for you.
Oh, thank you, my friend. Thank you.
Good for you.
I'm very excited. Now, this looks like it's got the new and improved sprayer too. Am I correct?
Yep.
Oh yeah. Okay, I'm going to do some right now.
Special order for Dr. Steve.
Yeah. So tell us what's in this stuff.
So peppermint oil, little vasodilator. So
the peppermint oil is for.
Well, it's
You don't want a vasodilator. You mean a vasoconstrictor.
Vasoconstrictor.
He's all nervous.
I'm nervous.
Oh, yeah.
But it's got,
this is 1,000 times better.
It's got a nice little bit of CBD.
Oh, and it's got an earthy, CBD kind of cannabis-y sort of smell. Not that I would know.
No, sir.
Tacie, you want to try it? No, I'm just kidding.
I'm good, thank you.
Good for you.
That is, now you've really done it, my friend.
Now we're into some things.
So you have buffered saline.
Yep, little honey.
And honey.
A little bit of salt. Yeah.
Sodium. Yep. Sodium chloride, right?
Mm-hmm. Yes, sir.
And just a little bit. Oh, we'll just put a little bit in. Well, you haven't measured out properly, right?
No, of course not. Of course not.
And then just dump some CBD and a little meth and
some
Miles fentanyl in there,
Miles
and it'll
Davis
be perfect.
would say the bitches brew as
yeah,
well.
There you
the
go.
bitches brew.
I used to do when I was in, I got my undergraduate in television production or radio, television, motion pictures, University of North Carolina, Chapel Hill. And I used to call it the Miles Davis technique. And if I ever made a mistake, I'd just say I meant to do it that way. That's what we always said Miles did. Sometimes. Miles was amazing.
There's no such thing as a wrong note, right?
That's right. Correct. There's no such thing as a wrong tracking shot. Anyway, all right. Well, I have a little something that I was going to talk about, and now I can't. Oh, here it is. Okay, I found it. So I saw this article. I've been going back and forth with a couple people ever since I was on Anthony's show this week, because of course we always have to talk about the vaccine, and so now I'm a shill for Pfizer. It's like, no, I'm absolutely anti-mandate. I don't think you should mandate something that hasn't been approved by the FDA. And even then, I'm not convinced. I mean, you have to make a pretty good argument to mandate something.
Yeah.
And I think it's people's choice. And you look at the evidence and, the vaccine absolutely causes myocarditis in some particularly young men. But you know what else does too? The virus. And the virus does it. And if you look at, it's not my data. You look at the data, it's 27 times more. Now, I don't want to fall victim to using that relative risk. We've been talking about relative versus absolute risk. The absolute risk is still very low. So you could have the absolute risk absolutist saying, well, the absolute risk is tiny. The risk to the individual is very low. But then you would have the relative risk absolutist that would say, well, 27%, 27 times better suppression of myocarditis if you get the vaccine is important too. So I don't know. But the thing is now, the data I don't have, and if somebody asked me about this, I'd have to say you got a good point. So I'm just going to give it to you now. I am not aware that we have data that shows if you have the vaccine and then you get COVID that there is a commensurate decrease in myocarditis. I don't know. I don't know that anybody has that data. So we know that the vaccine causes 27 times less myocarditis. Well, maybe it's just weaker antigenically, make up a word.
Yeah, I like it.
It's just weaker as far as its immune response than the virus, maybe. So the virus is more likely to cause myocarditis. But what if, the vaccine isn't much good if it doesn't prevent it, if you then get the virus,
right.
Because we know that the vaccine is not, it's leaky. It's not perfect for, not even close to perfect for preventing cases.
No.
It is pretty effective for preventing hospitalization and death, though, in in the right people. But anyway, so I've been going back and forth about that. So now I'm a shill for Pfizer. And then one of them I just said, you're aware that I'm anti-mandate, right? And they were like, no. And I was like, okay, then, let's move on.
They don't care.
Well, it's like, listen to the whole thing.
Yep.
And so anyway, this is a great article, though, and it says, FDA vaccine advisors, quote, disappointed, unquote, and, quote, angry that early data about new COVID-19 booster shot wasn't present for review last year. And I put this up as a tweet. I said, oh, they're angry and disappointed. It's good to know.
Yeah.
For the lack of transparency, that's what this article is about. This was about Moderna. This is not a Pfizer thing. That showed the updated booster might not be any more effective at preventing COVID-19 infections than the original shots. Matter of fact, I think in their study, the people who did not get the vaccine in their placebo group, 1.9% of them, let me see if I can find the numbers in this article, 1.9% of them got COVID, and in the vaccine group, it was 3.7%. Now, there's lots of things. Okay. Sorry, let me see. Okay. Well, among subjects with no evidence of prior infection, as well as those with evidence of prior infection, disease incidence rates were 2.4% for the group that received the original vaccine and 2.5% for those that got the booster. So let's see. I know that there was another. Now, and then they go on to say that we're angry and disappointed, but it wouldn't have changed our opinion. Okay, then why are you angry and disappointed then? Yeah. But the truth is that they weren't transparent. They didn't reveal all of this stuff. It may not have made any difference, but you can't. It looks bad.
Right.
It already looks bad. You've got people who don't trust. Now they don't trust scientific journals. They don't trust the New England Journal of Medicine, Journal of the American Medical Association, really top-notch journals that have real peer review. People aren't trusting that. They're not trusting our institutions, the FDA. They're not trusting the pharmaceutical companies, not trusting the WHO. I mean, people don't trust anybody. They don't trust the newspaper, but they do trust certain sources on Reddit and stuff like that. It's neither here nor there. Sometimes those sources are more accurate. I would tell you this, Joe Rogan's take on ivermectin was more accurate than CNN's for the longest time. And so how do you know? And I mean, who's vetting what Joe's saying? Well, you just have to we always say do your research. Well, I've done my research, so I know some things and that I disagree with certain people about. But this is bullshit.
Yeah.
And for them to have gone, I don't know if they're going to pass this if we show. I mean, that's what it looks like. And it doesn't help with the trust of the pharmaceutical industry, the FDA, and everybody. And so that's my hot take on that, is that, not presenting all your data in front of the FDA is bullshit.
Yeah, it really is. It's like cherry picking what you want to tell them.
Yeah, don't do that.
Yeah.
And then because they're going to find out later.
Yeah.
Now we've already paid them $2.5 billion or something. I don't know the right number of that. Together, the updated boosters from Pfizer and Moderna cost $5 billion to the taxpayers. We paid for that. Mm-hmm. Now I'm looking for there was other data here between the vaccinated and unvaccinated where it was surprising. But I can't find the numbers now. Of course, I can't. Because my highlighted version of this disappeared between when I did show prep and now, but anyway, so that's we're angry and disappointed too, Mr. and Ms. Doctor and Professor FDA vaccine advisors. Glad to know that they're upset about it. But anyway, all right, Tacie, you had something, right?
Yes, I have.
Oh, wait a minute. This is we have a new theme song for you. This is Tacie's Topic Time. It's time for Tacie's Topic Time with Tacie. Right. That's actually Carl from Who Are These podcast playing that, and that is the Harrison Blake Young theme song.
Sounds like Emily in Paris.
Does kind of sound like that because we're all about that right now.
Yes.
Did I say that?
Yes, you did.
Uh-oh.
Man, you are one pathetic loser.
But anyway, Harrison Young, I was on his show. It is on public access in somewhere in Massachusetts near Boston. And it was loads of fun to do. It's not up right now. Harrison is a different guy. He's a very different kind of dude. And he was profiled on WATP, and he took it so well that now everybody loves him. And Carl was on his show, and I was trying to get on before Carl, so just to kind of blow up his spot a little bit. But, of course, he's always one step ahead of me. Got on the week before. But it was fun. Half the time, his Boston accent is so thick, I could not understand the questions he was asking me. Right. So I just was going, hey, I don't know what you're saying, but here's this other thing I could tell you about. So we'll see if he keeps all that stuff in there, but it was funny. But that's his theme song, and Carl did it on guitar. So that's your new theme song, Tacie.
Well,
okay.
I was going to say, I hate to interrupt. I was going to say, but I missed just. I was.
Oh yeah, you were supposed to be there.
Yeah, I was supposed to come. I have a 250-gallon saltwater tank. I mean, it's huge in my living room.
Yeah.
And I did when I called you, I thought I had a leak outside, which I did.
Well, there was a deluge that day. We had like a almost like a tornado or a downdraft or something. And I'm like, oh my God, his house is flooded. He said, I can't be on Harrison Young because my house is flooded. And I'm thinking, oh Lord.
Oh yeah, I didn't realize.
You better go.
I had two problems. I had one outside. That storm was so bad it blew a bunch of debris in our gutter. And the water was pouring out like almost into our house.
Wow, that is very interesting. Please tell me more.
And then I got, but my fish tank was the problem.
The only reason I'm letting you tell this story is because I was so concerned for you and your house, and then I find out it's a effing fish tank.
But it was two things. But
you missed Harrison Young
I had to replumb this entire damn fish tank. It was awful. And then I had to climb up on the roof. Because we had another storm coming at night. So I was up on the roof.
Well, that's because you're an idiot.
So thanks for the sympathy, Dr. Steve.
In the dark, you climbed on your roof?
No sympathy.
You climbed on the roof?
Yeah, that night.
In the dark after a deluge?
That's correct.
Well, that's because you're an idiot.
Yeah, that's not smart, dude.
It was awful.
God. Well, I'm glad
I would have much rather been with you. I can promise you that.
Everything's okay now?
Yeah, thankfully.
Okay, good. We were going to play... Put me down a pallet on your floor for Harrison Young and kill 5 minutes.
Yep.
Instead, I had to talk about urethral meatus and try to say it in such a way that it was okay for cable access.
Oh, my God.
Anyway. All right, Tace, what do you got?
Okay. I have two little small stories.
Okay.
The first one is that kids under 14 are dying of fentanyl poisoning faster than any other age group, according to a new analysis from Families Against Fentanyl. And fentanyl poisoning occurs when people become in contact with or accidentally ingest the synthetic opioid, which is about 50 to 100 times more potent than morphine.
Yeah, 100 micrograms. 100 micrograms. That's 100, millionths of a gram is equivalent to 30 milligrams of oral morphine. And they, when you take a little spoon and go, well, let's take some fentanyl powder and put it in here, you're putting, milligram to gram amounts in there.
Yeah, and I wonder how much of this is accidental, or these kids are like, hey, let's try this, Well, I mean, it sounds like some of it is accidental.
Well, it's all accidental. I mean, they're not killing themselves on purpose.
No, good point. And between 2019 and 2021, the CDC said that deaths 14 and under increased faster than among any other U.S. age group.
Ugh. Well, they're smaller, so it might take less to kill them. And I'll tell you what I've been seeing, and I've had a bunch of people in my practice who have had positive THC, so they're doing street pot in Tennessee. It's not medical marijuana and legal.
Nope.
So if you're a cancer patient, you want pot, you either have to do the dronabinol pill, which is synthetic delta 9 THC, or you have to buy it on the street. Mm-hmm. And if you're buying it on the street, just north of us in Virginia, there.
I was going to say cross a couple state lines.
Well, just one state line, there is medical marijuana.
Yeah.
And if you go into a dispensary, you can say, I want something to sleep. I want something to wake me up. I want to laugh. I want to eat. I want to be hungry. And they can give you stuff. Well, if you go to your dealer, they just have a bale of pot. So if they want to compete with the dispensaries, they have to put a little fentanyl in, lace that in the pot for the sleepy pot, and then they'll put methamphetamine in the other pot and say, this is the stuff, this is your wake-up pot. And we have seen tons and tons and tons of this. Sometimes there's buprenorphine in it, but it's mostly fentanyl. Well, it's mostly fentanyl, buprenorphine, and methamphetamine that is this adulterated marijuana. And we used to be pretty tolerant, but now it's gotten dangerous. So what we really need to do is if that's going to be the response to having legal marijuana up above us, it's not, the response isn't crack down on it. Our cancer patients need it. Just legalize it. Let's get it over with. Because if you get your pot from a dispensary, it is highly, highly unlikely, to the point where it's vanishingly small odds that they're going to be lacing their product with methamphetamine, because they'll just get shut down.
Exactly.
The first gummy that goes out of there that somebody finds out they've got meth, and they'll shut down. Those
they're
are
so screwed.
Millions of dollars of investment to set up one of those places. In Virginia, I believe that they have to do the extraction and the manufacturing on site. So I'm not 100%.
It's highly regulated.
But it is highly regulated.
Yeah, it's good stuff. Yeah, see, the quality you can trust. Like almost it's regulated like a pharmacy.
Yep.
It really is.
Up there, the person running the one that I know about is a pharmacist. It may be that you have to be. I never looked into it.
I don't know. You might be right.
Yeah.
It would make sense though, because I mean, and I'm with you, and I've heard of another. Well, let's just say I heard a story the other day of someone who had thought they were getting a certain street drug and tested positive for fentanyl.
Yeah.
Yeah.
Well, yeah, we've seen
cocaine was laced with fentanyl.
Really? Now, why would they do that? Just another white
just
powder.
To cut it, just to cut it, and I think to make it more addictive, I guess.
Maybe.
Yeah, it's awful.
There's
terrible.
Yeah, it's awful.
We're seeing fentanyl pills that are stamped as if they're Xanax, all kinds of stuff like that. So I've said this from day one, 2007. I'm not a namby-pamby, just say no type of person, but it is getting more dangerous out there to mess around with street drugs. Even if you think you're getting a prescription drug that you're buying from somebody, that, you know, it's stamped right, and you look at, you do a pill identifier and it's correct, and it's still the wrong thing.
That's awful.
And we had somebody on this show that was several years ago that bought alprazolam or Xanax from what they thought was a Canadian pharmacy. When the box came, it was stamped the Seychelles, which is off the coast of Africa. And what was really in it was haloperidol, which is a major tranquilizer, also known as Haldol. We used to use it for psychotic people. We'll still use it for agitation, things like that. It has a similar enough effect that some people might be fooled by it, but it can also cause some serious side effects. One in particular called dystonic torticollis, where your head turns sideways. Yeah. I had let's say I heard of a case once when I was in residency of a guy that came into the emergency room and his head was turned like the Exorcist. You know, it was turned beyond where, and he couldn't unturn it. He couldn't look forward. It was just turned to the side. And I said, "What have you been doing?" He said, "Man, I've been doing speed all day. I've been doing speed." And I don't know. I said, "That's weird." Speed reaction. And he said, "Well, call my mom. She's got it." And so his mom had been giving him speed all day. And I got a hold of the mom, and she said, I said, "Can you read to me what's on?" She said, "Well, I've got a bottle of this speed." And I said, "Can you read to me on it?" And she said, "Sure, it's Navane," and it was Navane, which again is another antipsychotic. And so he was taking mega doses of antipsychotics thinking it was speed and wondering why he wasn't getting speedy, but then his head kept turning to the side.
That's
rats. So I went in and I gave him one dose of a medication called Cogentin intravenously. And his head just went back to normal. He's like, "Whoa, hey, thanks." And, you know, he was
see you later.
On, yeah, see you later. And I'm like, "No more speed, dude. Jesus, come on." So my concern is, so I'm not a namby-pamby. Just say no. None of us in here really are. But if you've ever had a pill that you got from the pharmacy that wasn't what it was supposed to be, that happened to our friend not too long ago, who got Cymbalta instead of her PPI. Don't say her name, but
I wasn't going to.
Okay. I'm just okay. Wasn't that what it was?
Yes.
She was supposed to get her stomach medicine.
Yes.
And they gave her an antidepressant instead. And she wondered why her reflux was so bad.
Oh, goodness.
Why she was feeling weird. And it happens.
She was feeling really weird and just terrible. And
especially she'd never taken
coming
something
off of it was awful for her.
Yeah, so she had problems with that too. So she had reflux and she had withdrawal from the Cymbalta because she'd taken it for a long time.
Okay.
And my point is not to not trust your pharmacist. Always obviously check.
Sure.
If you get something, you should always do that. Yeah. You should check when you go to the grocery store. Make sure that all the things that you thought were in there were in there. But the thing is that might happen one time out of let's just say 1 million scripts, 100,000 scripts is very rare, but it happens. But if I can't 100% trust my pharmacist, I can trust them 99.99999% of the time. If I can't trust them 100%, why would I trust somebody that's just selling me something off the street? I'm sorry, I just
pulling it out of his back pocket,
particularly or under their nuts, like they did when I was in the Bahamas.
Yeah.
You know, they were.
You witnessed somebody pulling stuff out of there.
Yeah, no, they were trying to sell it to me, and they're like, "Hey, you want some pot?" And I'm like, "I don't think so." And then he reaches into his pants and pulls it out from under his scrotum, and he's got these dime bags of pot. And it's like in the Bahamas, highly illegal. It's like, dude, put that away. I'm not giving you any money. I'll give you money to go away. I don't want your stuff. But anyway, why would I trust that?
No.
And particularly now, my message is a little bit more acidic because I've seen these things, and it's getting more dangerous. In the age of fentanyl, street drugs have become a little bit more, a lot more dangerous.
Yeah.
As the number of pills that are prescribed by physicians decreases, and I listen, we've thrown out the baby with the bathwater on for some of our chronic pain patients, no question about it.
Agreed.
And actually, Tennessee's response to it was really good. That they said, listen, if you've been on opioids for more than 90 days, we're going to leave you alone. We're going to try to prevent future cases of people who are injured by being put on opioids as a normal prescription. So they're limiting the amount that you can give for post-surgical procedures and stuff. But if you've been on it 90 days, it doesn't apply to you.
Okay.
And I when I first realized that, it was like, this is a rule that it has some common sense. So,
right.
And it's kind of like, okay, this bunch of people, we're going to deal with them later.
Right.
Maybe, if they need to, we'll get them into counseling. We now have 2 or 3 places here where we used to have 0 for drug counseling. So, and that's increased throughout the country to some degree. So we're doing something about the demand. But anyway, now I don't remember what I was talking about. Anyway,
but you are correct. Yeah. They're making some good strides forward.
Shit, I had a point to make.
Uh-oh.
Yeah, and I got off on the rabbit.
You were dreaming of the.
Well, I was dreaming of the great
of
point.
Weed.
Yeah, maybe that's
in the
what
state
it was.
of Tennessee.
What were we talking about? We could be.
Can I do my
planet
news story now?
Thumbnail of a giant.
You're just getting weird.
Okay, sorry.
Okay.
I was doing pot talk.
Yeah.
Go ahead, Tacie.
Okay, so a California woman contracts HPV-related nail cancer following a visit to a salon.
Nail what?
Yes, it was a new salon. Her salon was booked, and her cuticle got nicked. It got nicked deep, and the wound didn't heal. After months and months and many doctor visits, her doctor sent her to a dermatologist. And she got a skin cancer diagnosis, squamous cell carcinoma.
Okay, yes.
Which was caused by high-risk HPV stage 1. The doctor said almost every skin cancer involving fingers or nails have been associated with high-risk HPV, and it's in younger patients. But the vaccine prevents it.
Yes, so the Gardasil will prevent cancer from HPV 16 and the other one. So get your kids vaccinated. We got ours vaccinated.
Yeah.
It doesn't stop them from getting HPV. It just it stops them from dying from the bad kind of HPV.
Yeah, I still wonder, though, I mean, if that's the case, I wonder why they don't change the recommendations and they can't get the shots even if you're older than a teenager.
I think you should be able to do a serologic test because they're saying, listen, if you've already been exposed to it, it doesn't do any good.
Okay.
And maybe it does some harm in that case. I can't imagine that it does, but okay. So they're saying, but they increased it to 23. Gotcha. But I think if something, God forbid, happened to Tacie, and I would go get a serologic test, say you've never been exposed to HPV 16. It's like, hell, sign me up.
Give me a shot, baby. I'm cutting loose.
That's right. But anyway, I do remember what I was going to say. We were throwing the baby out with the bathwater with the chronic pain patients, but we have decreased the amount of opioids that are on the market that are prescription opioids. And as you see that falling precipitously since 2010, you see the number of overdoses from opioids rising at an almost exponential rate. Now, why is that? It's because when you're taking prescription drugs, you sort of know, hey, I'm 40 milligrams of oxycodone is sort of my jam. But when you get a little packet of powder and somebody's dumped fentanyl in it and there's no way to know how much is in there, then it's much more dangerous. So anyway, that was the point I was getting at.
That was a good point.
Good point.
Thank you.
That was well worth it.
Anyway, and get your kids vaccinated for the Gardasil. That one is FDA approved. It's been demonstrated to work very well, and we are going to see continued decreases in deaths from cervical cancer because of that vaccine. We're already seeing significant decreases in precancerous lesions. Hadn't been out really long enough for women to get old enough to start.
Well, and you wouldn't think HPV on a finger, right?
Yeah.
You wouldn't think that.
Sure.
So if you've got a
it's
place
a damn
that's
cancer
not
virus.
Yeah, if you've got a place that's not healing, go to the dermatologist.
Yeah, that's true.
Get it checked out.
Good point, Tace. Mm-hmm. Yeah, HPV, that one, wherever it goes, you could have problems if it ends up in your nasopharynx, because, I don't know, perhaps you put your mouth someplace, and it was quite delightful at the time, but you got a little virus in there that can cause head and neck cancer.
Yes.
If secretions and fluids drip down and get in your anus, it can cause rectal cancer. I'll assume that's how that happens. Mm-hmm. And then, cervical cancer for sure, and penile cancer. So it's all the places where that HPV can go. And it is unlikely for those human papillomaviruses to end up on skin, but if you get a nick like that person did, and they've got the virus, and it's just a perfect storm of shitty events, then it can happen.
That's bad. That's bad luck.
But now the squamous cell skin cancer is usually very easy to treat.
Oh, good.
Yeah, good. So, all right, very good. Well, thank you, Tacie.
I did homework.
You
Way to
did.
go, Tace.
It's number one.
Yay.
Uh-oh. Oh, wrong pot. Sorry.
Give yourself a bill.
There you go. And also,
Suck it.
Stabbed to the heart.
Suck it.
this has been Tacie's Topic Time with Tacie. Associate producer, Dr. Scott. Music by Carl Hamburger. Topic Time theme used by permission by Harrison Young. Wish I had a script for that. I would have done a little bit of... All right, very good.
The bill-less.
Do we have
Dr.
questions?
Scott,
Yeah, sure we do.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Do you want to do some questions?
Yeah, I think people like it when we
Number one thing, don't take advice from some asshole on the radio.
All right, we'll do it. Here we go. Thank you for your questions, everyone.
Hey, Dr.
347-766-4323, and your questions mostly get answered. I downloaded one from 2014 today that we never got to.
Oh, goodness.
So, I know. Anyway, we might get to do that one.
Hey, Dr. Scott. I called in a few weeks back about need to urinate or urge to urinate after I jerk off.
Oh, yeah. And I actually, dude, I talked about you on Harrison Young's show. That was one of our most requested questions is post-coital male, urethral burning.
You gave me the advice to soak my junk in warm water, and want to let you know that actually worked quite well.
Yay.
The sensation subsides after just a couple minutes as opposed to, half hour to an hour. So really good tip to not keep me up at night. I also have a
Give
follow-up
yourself a
for,
bill.
Give myself
question. I have gynecomastia. I've had it. I developed it probably as a young teen when I was quite overweight.
Okay.
But with a teenage history of eating disorders, I went from very overweight, obese, to anorexic and underweight. But even through all that, still had gynecomastia.
Okay.
Now I'm healthy, fit, 20-something, and still have them.
Okay.
Still have my tits. They're probably about an A cup, so fairly sizable for a male. Anyway, was just curious if, as I get older, I should be concerned about possible increased risk of breast cancer, and if that's something I should talk to my doctor about getting screened for as I get older.
Okay, yes. So let's talk about gynecomastia. It's just enlarged male breast tissue.
Right.
And it can be caused in boys or men, usually caused by imbalance of hormones between estrogen and testosterone. And so when he was overweight, he was converting some of his precursors to estrogen instead of testosterone. And fat tissue plays a role in that. And so he built up some glandular tissue. And when he lost weight, it didn't go away because the glands are still there.
Right.
Now, there is a thing called pseudogynecomastia, and that's where people just get an increase in fat tissue, but not glandular tissue. And those people, when they lose the weight, the breast tissue goes away. Now, newborns can sometimes get nodules under the nipple, and moms will go crazy thinking that, oh, my newborn has breast cancer. But a lot of times that's from estrogen transferred to the boy from the mother's bloodstream.
Okay.
While they were attached together in the placenta. And older men can get it just because they're not making as much testosterone anymore. And then boys going through puberty sometimes would come in and they would have this sort of firm nodule under the nipple, and moms would again be freaking out, or the kid would be, and we could reassure them that was going to go away. But if you have enlarged breast tissue, very often it'll go away if it's transient through puberty. But if you're an adult and it doesn't, then you can do stuff about it. So there are several things that can be done. Scott, you got any info on this from your standpoint before I go on to the Western medicine part?
Well, I was going to say exactly like you. Typically, it's just an imbalance of fat tissue. I've seen it in young males that have a really heavy diet full of chicken.
Oh, because they're getting it from the hormones.
Instead of hormone-free chicken.
So you want organic chicken, man. Have you seen some of these chicken breasts?
And non-hormone fed.
Sam, the cooking guy, had a chicken breast on the other day. I swear it came from a turkey. It was gigantic. It's just not normal.
No.
So poor chickens were just ripping their chest muscles off and their legs. and just eating their legs.
It looked good, though.
They are so good.
Gross.
You get 4 of them. You get 2 wings and 2 legs off each chicken. It's pretty damn good. Thigh meat's all right.
That's awful.
Then we boil their carcass down and make stock out of it. Jesus.
And you fry the skin.
Yes.
Fry the skin
and then we're eating their skin. Just imagine
if
chickens were sentient. They would be horrified.
That would be awful.
It's just chicken apocalypse.
Oh my word!
There's chicken everywhere.
Yes. Happy years ago. I mean, it's been 10 years ago.
Yeah, we were talking about
Super Bowl.
Super Bowl. How many?
The chicken. I'll look it up.
Almost got. We've got a new friend on this show is ChatGPT. Of course it's Saturday. ChatGPT is too busy to talk to us. I actually paid for one. We have an AI assistant now called Right Sonic. Go ahead.
I just Googled it. Said 1.42 billion chicken wings
just on
Super Bowl Sunday. 1.42 billion chicken wings.
So that's so that would be what 550 million chickens.
Yeah, or
something like
600 million. Yeah,
poor chickens.
700 million chickens.
Ugh.
Hell,
and they're born, and you come out of you peck your way out of
feeling
the
pretty good about
egg
themselves.
And,
or
yeah,
eating some
and
good
you look
food.
around, and it's like, what the fuck is this? Where'd all these other chickens come from? Why does it smell so bad in
nice
here?
air conditioned area. They're loving. Their friends are running around.
I
having a
do
good
buy.
time.
I've fallen for it. I buy the free range chicken shit whenever I can. I mean, they still kill them and eat them, but it just seems somehow less just horrific. But anyway, we're having chicken tonight, and it's awfully tasty. So sorry, chickens. Where were we?
Oh, we're talking about Gynecomastia.
Gynecomastia.
We have a good couple things from the the waiting room. Go ahead.
So treatment. If it's just transient hormonal changes, no treatment is required. And
will it go away?
That's what I'm saying. The transient ones do.
Oh yeah, transient.
The ones that were, the ones that are related to puberty or newborn and stuff like that. But if it doesn't go away and you're an adult, and like in this guy doesn't go away, you can take medication. There is a medication called tamoxifen, which we use in. It's an aromatase inhibitor, and we use it in breast cancer to suppress estrogen at the level of the cell, estrogen's effects on the cell. And Arimidex is another one. And they are not approved for use in gynecomastia, but they have been. Would I put a young male on tamoxifen or Arimidex or other aromatase inhibitors? I don't know if I would. They can also, the aromatase inhibitors can also cause aromatase inhibitor associated arthralgia. In other words, they get pain in the joints from taking those. It's about 5%, but still you got to be aware of that. But the other thing is it's liposuction. If you're in good shape now and you've got muscle tissue under there and you just can't see your massive pecs because you've got A cups laying on top of them, doing liposuction could be the thing. That's I've seen males do liposuction before and done very well with it. You want to find a place that does a lot of it, that are well versed in doing this. There are some complications that can be had with liposuction, but that would be my preferred thing. You do have to screen for breast cancer, but all males do.
Yeah.
1 out of 100 cases of breast cancer is in a male. And I think there's only like maybe 2,000 cases of male breast cancer actually diagnosed annually, and about 400 men die of it. So if that number is right, that means about 1 in 5 die from it. So you want to catch it early. Early detection is the thing. So feel for it.
So is this issue?
It's a very, very small increase in risk.
Are you more likely to get breast cancer if you have it?
Very slight increase in risk. So instead of 1 in 100 people, it might be 1 in 95.
Okay.
Something like that.
Okay.
Or 1 in 100 cases is a male, and of those, maybe a few of those wouldn't have gotten it if they hadn't had gynecomastia. Put it that way. It's probably a better way to state it. All right. Good idea to do periodic self-exams. If you've got really big gynecomastia, then you're going to have to get a mammogram. And removing that tissue, of course, will decrease your risk back to normal for getting male breast cancer. But I don't know that I'd go so far as having a mastectomy unless I just had, like D-cups or something, All right. But see a plastic surgeon. Plastic surgeons are the ones that deal with that.
Yeah.
All right.
Hey, look who just joined us.
Who's that?
Tacie DeLoach.
Oh, really? Oh, hello. Hello, my friend. We don't have any Tacie DeLoach questions.
I know it. We're having to make questions up.
I know. You're right. We're having to make up questions. Let's try this one, though. I think this is a good one. I have to add the .mp3, though. Sorry. I apparently didn't do that when I put this in here. There we go. All right. Let's try this one.
Hey, guys.
Hey.
So, by the way, Santa loved himself a woman that wasn't clean.
Okay.
That's a line from Bad Santa.
Oh,
Billy Bob Thornton.
That's where that came from. Okay, he said that last week. This is the
Okay.
same guy.
Okay.
Okay, all right.
Anyway, so I did my...
Never seen Bad Santa. I don't like bad Santas. I like good Santas. Except if it's what did we watch? Violent Night.
Violent
It's
Night
the most
was
ridiculous
awesome.
thing. I loved it. So stupid.
My cycle of antibiotics and whatnot.
Yes.
And my drippy meatus seemed to...
I'm going to give you a bell for the proper use of that word, my friend.
Bill.
Yes. The meatus, a.k.a. the cockhole.
But back now, so I guess I'm going back. Anything I need to look out for, ask for,
Well, okay. Yeah, I want to know what they tested him for.
consider whenever. I did get the 2 tests for gonorrhea and chlamydia.
Okay.
Those both came back negative, so they had me pee in a cup. That's all I did, really. And they gave me antibiotics and showed me the door.
They had you pee in a cup. I think that is less sensitive test than sticking a swab up your, meatus and letting it sit there for 20 seconds and then twisting it around. It's agony. I mean, it causes some significant discomfort, but it is a very small swab. But when it's going up your urethral meatus, it feels like it's 10 miles wide.
It's a sensitive area.
Slightly. So, there are other STDs. If they didn't look at it under the microscope, they couldn't diagnose trichomonas. They may have missed chlamydia and gonorrhea, and now the problem is they put you on an antibiotic, and so they're going to be less likely to detect it now, even though there might be something residual there. You may have a thing called nonspecific urethritis. There is a treatment for this. There's a treatment protocol. A lot of times they'll give you a shot of Rocephin or ceftriaxone and then give you doxycycline for 10 days or whatever. And there are some resistant strains, too, and those need to be treated differently. So they need to do the next level diagnosis. So please go do that. Let us know next week. This will be the 3rd week in a row what happened to you and if you got any relief. So just for everyone else's edification, wrap that rascal and use something to prevent disease, okay? All right, thank you. End of soapbox.
Hey, Dr. Steve.
Ooh,
I'm calling from Pennsylvania. My name
girl.
is Sandra.
Hello,
and
Sandra.
I'm calling about my husband. He
Boo.
Yeah, right. We've heard that before. Nice try.
He has, he's not ever been circumcised, and he is now in his mid-50s and is having issues with the skin not being able to pull back over his head. And we have some problems in the bedroom when we enjoy one another's company. It gets torn.
What's that like?
Then is out of commission for a couple of weeks.
Ooh,
so
I
he
bet.
really doesn't want to get a circumcision at this point in his life. But we're kind of scared that he might need that because it seems like he gets scarring on his foreskin,
Yes.
and it's not able
No, it doesn't
to
heal.
retract, and it's going to cause more problems. So
Right.
we're not really sure where to go with this. We have seen a urologist and really didn't get a lot of information at the time, so kind of just wanted to get your idea. I've heard there are creams that could possibly help. So just let us know what you think. Thanks.
There are, and thank you for calling for your husband. Matter of fact, she sent me a message on the voicemail thing, because I try to respond to the voicemails, and she said she appreciated Tacie being here to discuss, female urologic things.
Cool.
But then she said, having a dick. Well, no, what it was she said, thanks for helping me with my husband. Having a dick sounds like it's, really a pain in the ass. And I said, well, there's an obvious joke there. But I said, having a vag also is no walk in the park, according to my wife. And she said, thank you for Tacie for being here to give the woman's
That's
side.
very nice.
That there are
There you go,
actually women listeners other than Amanda. And
Her and the other
Patty,
one.
and
Yeah,
Patty,
Patty,
and the other one. Patty, you're now the other one. So anyway, and if you wonder who we're talking to people in the waiting room.
Yes.
Which you can join us on YouTube Saturdays at 1 p.m. Just follow my Twitter at Weird Medicine, and usually around 1 p.m. I'll tweet out the link, and then you can come just hang out in the room. And we don't make a big deal out of the video presence. If we have 10 people, I'm happy. We get all of our stuff from listens on our podcast and on Sirius XM. But anyway, okay, so creams. I think this guy's beyond creams. If they're having sex and his foreskin is ripping and then it's scarring down, I think really we're beyond cream. He could try it. They'll give them a hormone cream that will help to loosen up the foreskin and try to get it to retract back. But this is what's going to happen if it continues to scar. And this is called phimosis, by the way. If it continues to scar, one day he's going to retract it, and he won't be able to retract it back.
Oh.
And when that happens, that is a medical or surgical emergency. If he doesn't get surgical treatment stat, what'll happen is the head of his penis will slough off. He'll kill it, and it'll slough off.
Oh.
Yes.
So not a lot of options, really.
No, I would. I mean, if he really just doesn't want to have a circumcision, go ahead and get the cream. But you're going to want to see a urologist. See them now. Let them examine you, and they're not going to be knife happy on this. They know people don't want circumcisions. They don't exactly get a big kick out of doing adult circumcisions either. But our friend Jefferson the Shyster had one. And he showed it to us here back before we had cameras in the studio. And he was playing baseball the next day. So it used to be if you had a circumcision, like Sam Roberts had one. This is what Sam Roberts had. Sam Roberts' phimosis was so tight that he couldn't retract it at all. So he didn't have problems with it ripping. But when he would pee, it would fill up like a balloon. And then he'd have to squeeze it, to get the pressure up high enough to get the urine out. And if you've gone that far, I mean, I think he was 18 or something. He was young.
Yeah.
And he had an adult circumcision. Well, adult. I mean, is Sam even an adult now? But he had an he had a circumcision over the age of 18. And I think he was on the couch for a week or two. But they do it differently now. Mm-hmm. And the way Jefferson's was done was different than I've ever seen it, where he had a ring of stitches going all the way around, where they had joined up the shaft skin with the
Roman war helmet
with
skin.
the Roman war helmet skin, yes.
Yeah, he had almost
I'm just
zero
talking
pain.
about shaft.
No, yeah, he had almost no pain.
Yep. No, nothing.
Yeah, he did extremely
literally playing baseball the next day.
Yeah, I would say in lieu of tearing it anymore, I'd probably look at some.
Yeah, just go see a urologist.
Yes. Trim.
And you could probably convince them to just give you the cream, but I really think at this point it's affecting their enjoyment. He doesn't want to do it because every time he does it, it hurts.
Yeah, so
I mean, you hear about women who have dyspareunia, which is pain during intercourse. They just don't want to have intercourse anymore. If you have pain when you eat, you don't want to eat. When my feet hurt, I don't want to walk. I totally get it. So if it's affecting your ability to, dance the dance of the two-backed beast, then I would absolutely go get that fixed.
Well, they did go to a urologist. Maybe go to a different one.
Oh,
'cause they didn't
did she
get
say they
any-
went to a urologist?
Yeah, and
What
she
did he
said
say?
they didn't get any information. Yeah.
Oh, shit, I missed that.
Somebody wasn't trying.
Too busy
Yeah.
thinking about what I was. Oh, no, that's terrible.
That's awful. Somebody wasn't trying. Come on, make an effort.
If they just blew you off, I probably would not go back. Now, but this is a good point to talk about in general. If you go to your primary care provider or anybody else and they give you something and it doesn't work, don't go, well, they don't know nothing, I'm going somewhere else, because that person's going to have to start over from square one. Go back to that one, say, hey, this didn't work. Can we go to plan B?
Yeah, what are your other suggestions?
It tells them,
That's a good point.
when the obvious thing isn't it, then it tells them that, okay, it's like you're doing an experiment whenever you treat somebody. And if it doesn't work, you are informing them that that hypothesis was incorrect, and now they'll have another hypothesis. We have these things called differential diagnosis. And we start working our way down the list. So give them the opportunity to try to make good on that. Because a lot of times that first intervention that they're doing is just a test to see if they got it right the first time. So, Dr. Scott, you got anything else for us?
Yeah, we've got two from our fluid family.
Oh, is that what it is now?
That's our, we have a new
fluid
name.
Family.
The fluid family.
They name themselves that?
Yeah.
If you name yourself a nickname, it doesn't stick. But that,
well, technically,
That
I
one I think
suggested
will,
it.
though.
I suggested
Fluid
it.
family.
They agreed. So
They-
it was better than
they're
waiting
gender
room.
fluid. How about that?
Yes. Oh no, it's too late, Dr. Steve. We've already been voted out. That's the fluid family.
Okay, all right,
So
fair
so Kevin 28.
Well,
was
the
just,
fluid family. Oh, yeah. Hey, the fluids are in the waiting room. It's the fluid family.
Exactly. You got
Okay,
it.
fair enough.
See, Dr. Steve's in now, guys.
I'm into it.
Yeah, so as an MD and a TCM practitioner, how do you guys feel about chiropractors? Is it effective for neck and back issues, or is it snake oils? The history and founding of the field seems a bit questionable.
Well, the history and founding of
medicine
is really questionable, so I wouldn't worry about that.
No, I think it's just like every single profession. There are some chiropractors out there that are absolutely incredible.
Yeah,
I mean healers, brilliant people, and then there's some not so couth chiropractors as well. But I think many of the ones that we use are super. They know their stuff. They know when to do their medicine. They know when to refer out for help. And so I think it's just like anything else. If you find the right one, they're probably pretty special people.
Yeah. If you go to, a body shop and they start saying, well, I could, make you, I could make you a pretty new dress, that would be stupid, right?
Yeah.
And so if you go to a chiropractor and they tell you, I'm going to cure your cancer with coffee enema, that's outside their wheelhouse.
Right.
That particular treatment would be outside the wheelhouse for just about every provider. So, but chiropractic care is considered effective for various forms of neck and back pain, and there are some, research studies, and not all of them are in chiropractic journals, that say chiropractic adjustments may be effective treatment for acute low back pain and neck pain and stuff like that. The problem is it's very hard to do a double-blind, placebo-controlled study, but if you go see one and they want to sign you up for 20 visits and, hey, pay up front, how about let's do a couple and see how it goes.
Yeah, see where it's going, yep.
And I'm not saying they're unscrupulous. I mean, there are, like Scott said, there's unscrupulous people everywhere.
Sure.
We used to have a chiropractor on the show all the time.
She's incredible.
Sadly no longer with us.
She was an angel.
But Dr. K was awesome. She was fun to have on here, and she knew some stuff. And when it came to back and neck pain, she'd pop in and. But she was one of those, as you said, that knew their lane. It's like I have got to know my lane in medicine.
Yep.
I shouldn't be, trying to give people chemo.
Yeah.
Because I have not been trained in that. And I tell my patients coming to me for influenza at this point is like going to Lane Bryant for tires. So, anyway.
Hey, Kevin had a follow-up question. Hey, why doesn't Dr. Steve has as bad of a hillbilly accent as Dr. Scott and Tacie?
Oh, there's a good question for that.
I answered it for you.
A good answer. Oh, you did?
I told him you're the highfalutin hillbilly.
Yeah, that's right. No, I do have
You do.
that.
I know you do. Mine's actually worse than this.
You just don't hear it because I went to school to get rid of it.
Yeah.
And my original degree was in broadcasting, and to graduate from the radio, television, motion pictures program, you had to take Earl Wynn's Speech 1 and 2. And what we didn't know was what he was doing was indoctrinating us in a neutral accent, and we had no idea. We would go in there every day and go, why in the hell are we having to learn this international phonetic alphabet? So they would give us this thing called the International Phonetic Alphabet has a symbol for every sound that the human vocal cords can make. And so if you learn all of those sounds, you can write a script in Cockney English, and if you know the sounds, when you read it, you'll sound like someone that is from wherever, North London or where. Sorry to all my UK brothers and sisters. I don't know where the Cockney accent comes from. I should have just said Liverpool, because I could have said then, you sound like as if you were Liverpudlian. But what they would do is they made us, the first semester was just learning the International Phonetic Alphabet. And every day we'd go in there and we'd have to learn more symbols and then say them. And then the second semester, you had to read scripts that were written in International Phonetic Alphabet, but it was written with neutral accent in mind. And so a lot of my Southern accent has creeped back, of course, because, it's been 40 years since I went to college. But at the end of that class, none of us had our native accent anymore. Now, I used to, when I lived back there in the holler, I would talk more like that. That's a little bit of a parody now, but that's a lot closer to the way I used to talk than this is.
I mean, I take out a lot of my redneck accent to do the radio show. So,
Yeah,
if you think this is bad, you should hear me in real life.
You should hear her when she's...
Especially after she's had a drink or
Oh,
two.
good Lord.
Lord.
And kicking somebody out of the house because
Lord,
cried or
when
something.
she gets that hair on the back of her neck stands up, you better look out.
One time, this guy,
out.
we had our kid in the car. We were going to the beach for the first time with our kid. He was probably, 6 months old, 8 months old at that time. And some guy, I pulled in. I didn't know he was pulling out. He started cussing at us and all this stuff. And he started yelling at Tacie. Well, she started saying stuff to him. I'm like, hey, dude, have a great day and all this. But he wouldn't stop.
Oh, no.
And then he's like, I'm going to kick your ass. And Tacie was like, well, I'm going to kick your ass. And he said, oh, get the hell out of here, you fat, ugly cow, or something like that. Now, listen, back then particularly, this was, 20 years ago, Tacie was quite the striking young lady. And she was.
Shit happens, but thanks God.
All right. I'm not. How do you say that? Tacie was hot just like she is now.
There you go. Now it's better.
And I kind of fucked that one up, didn't I?
It's true, Steve. It's all right.
But you were anything other than what he was calling you, and Tacie was like,
I had my phone and I said, look, the police station is across the street.
Yeah.
I'm dialing 911 right now. Get the fuck out of here now.
And then he was like, you're ugly. And she's like, I'm hot. Sounded like Angela from 90 Day Fiancé.
Now listen.
Oh, my.
Now you're
a little deeper in the well.
Something's going to be said later on.
That's what I'm talking about. I'm glad I'm out of here in about 10 minutes.
You don't think so? You were just saying that your accent is worse. I was just giving an example of what might bring it out.
Dig.
Oh, for fuck's sake. Anyway. All right. So where were we? Talking about chiropractors.
Yeah, so anyway, yes. One last question.
There was a study in the Journal of the American Medical Association that found that chiropractic care combined with usual medical care for low back pain provided greater pain relief and greater reduction in disability than medical care alone. So that's good enough for me. If you think it helps you, great. If you don't, then just move on. Don't sign up for 20 visits. All right. What else you got?
Yeah, last one was from 89 Brooks, just asking about if there are traditional Chinese herbs that can help with the gynecomastia.
Yeah, that's a good one. Do you have any sort of estrogen blockers? I know you have all kinds of pro-estrogenic things.
Well, what I would do first of all, there are a class of herbs that help drain phlegm. So that's one thing I would use. The other thing I would use is a class of herbs that might help enhance the testosterone production and support the male.
Well, why don't we just do a PubMed? Just see if someone's ever done a study on that.
Yeah.
So
check out Rusong.
How do you spell it?
Rusong, R-U-C-O-N-G.
C-O-N-G?
Yeah.
Okay. Rusong.
Rusong Wong.
W-A-N-G?
Yeah.
W-A-N-G. So you're going to Rusong your Wong?
Well, you would give you the scientific.
Yeah.
C-I-S-T-A-N-C-H-E. Cistanci tubulosa. Cistanci tubulosa.
Oh, there it is.
And of course, you can always use astragalus.
Astragalus, right? Okay, Cistanci tubulosa and gynecomastia. Let's look at that.
Oh, no, I bet it's never been. You never know. You never know. Yeah,
nope, nothing on that.
Yeah. But that's what I would use something like that. If they wanted me to try and help, that's what I would do first.
Okay.
Yeah. All right. And first take them off of chicken, hormone-fed chicken for sure. Or anything else that might be making
that might be exacerbating it.
Yeah.
Good one. Okay.
That's what I would do.
All right.
Hey, Carla's made it.
Who?
What's up, Carla?
Carla
Finch.
Oh, Carla. Yay. Hello, Carla. We were on her Bennington group chat one time. You remember that, Tace? That was fun. It was during COVID. And we got together downstairs, and there were all those people on the thing, and we talked to them.
Oh, yeah.
Yeah, that was Carla who set that up. All right. Well, thanks, everyone, and appreciate everyone being here and everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. And don't forget Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everybody.
Bye, guys.